start. Okay, hi. Thanks for meeting with me today. As we talked earlier, this is a training exercise for me, and the questionnaires you completed are not meant to be for a formal diagnosis. They're simply just a general idea of how you've been feeling lately, especially mood and with anxiety. The goal today is to walk you through your results and suggest simple, everyday things that you can do and check with, how it fits with your experience and answer any questions you might have.
Okay, sounds great.
Okay. So you filled out two questionnaires. One looked at mood, especially with feelings related to sadness, motivation, and self confidence. The other looked at anxiety, which covers things like worry, tension, physical symptoms, and how often you feel on the edge. Um, so we're going to review your depression results, which was the BDI. Your score was a 15, which falls in a range that usually reflects mild mood disturbance. What that means in everyday terms is that you may be expecting things like feeling down or discouraged at times, low motivation or energy, having a harder time enjoying things that you normally would, or occasional negative thoughts about yourself. This doesn't necessarily mean you're depressed, but it does suggest that some mood related concerns have been affecting you more than just occasionally.
Yeah, that sounds accurate.
Okay, so the BAI results for anxiety, you scored a 23, which falls in the moderate anxiety range. People who score in this range often report things like feeling tense or nervous, worrying often, physical symptoms such as tightness in the chest, shakiness, or trouble relaxing, and feeling overwhelmed or on the edge. And again, this score doesn't diagnose any anxiety disorder, but it does suggest anxiety has been showing up enough to impact your day to day well being. Um, Taken together, your results show that mild mood concerns and moderate anxiety are present for you right now. It's very common for mood and anxiety to overlap. When people feel anxious, it could affect their mood, and when their mood is low, anxiety can increase. What's most important is understanding how these experiences are showing up in your life and figuring out what supports or coping strategies can be helpful. So does this description of mild mood disturbance make sense to you?
Yeah, that makes sense, and it tracks with yeah how I'm feeling, how kind of I'm moving throughout day to day life. So it wasn't really surprising to me those scores.
Mhm. How about anxiety piece? Does that match your recent experience?
I think so. I feel like the questions were really they were easy to understand, and um it made sense, and it definitely it definitely reflected how I've been feeling recently, especially with the holidays coming up and everything.
Mhm. Makes sense. Well, in a real counseling setting, this would help guide us in exploring what situations, stressors, or patterns contribute to your mood or anxiety. We'd also focus on strategies that help you feel more grounded, less overwhelmed, and more in control. For today, since this is a training exercise, the goal is simply to help you understand what the questionnaire suggests. So, thank you again for participating in this role play. And before we finish, do you have any questions about what the scores mean or anything you like me to go over again?
Um, my only question is, would you recommend um like medicating at this level of anxiety and depression, or would this be something that would be more recommended or more easily treated through like counseling sessions?
Well, yeah. So since if you following the mild area, I wouldn't suggest medication. I would, like I said, just come up with coping strategies and things that you can work on, and also just maybe counseling, maybe twice a month, something along that line.
Okay, excellent. Thank you.
Thank you.
Okay, yay. Perfect. That was awesome. Okay, I'm gonna stop that one. Actually, no. I'm gonna keep it all as one, and then I'm gonna cut it and then upload it,
Okay.
and then I'll send you the link once it's all done.
Okay.
But okay, are you ready for your turn?
Yes.
Okay, awesome. Well, hello, Tatiana. Welcome. Thank you so much for attending this session. As you probably recall, we administered the Beck Depression Inventory and the Beck Anxiety Inventory in preparation for this mock session today and for this mock review of those results today. It looks like you had a pretty mild to low scores on both of those. What was your experience in taking both of those, at least the first one? Let's start with the depression inventory. Do you feel like those questions were representative of how you're feeling, or do you feel like they were kind of off at all?
I feel like they were easy and straightforward. I feel like I went right through it with, if it's self-explanatory. I went right through them without anything being too complicated.
Okay, yeah. Would you say the same for the anxiety inventory as well?
No, that one was pretty. I wouldn't say hard, but it's a little difficult because it was answers that you can fall into both, but you didn't want to give yourself the highest score. Like you could have been a 1 or a 2, things like that.
Do you feel like you were in between for a lot of the scores on that one?
Yeah.
Okay, yeah. That's interesting. I feel like that's probably a pretty common occurrence. They sometimes the questions feel really cut and dry on them, and it's not really necessarily how human experience works. But overall, how would you say you feel about your experience taking both of those? Do you feel like they reflected accurately like what's going on, or do you feel like they were kind of need a little bit more assessment?
Well, I feel like maybe regardless if I picked a 1 or 2, I probably would have still had the same, fell in the same score range.
Okay.
So I think I scored correctly.
Okay, awesome. I'm glad to hear that. Well, you did score pretty mild to low on both of those, which means that you're probably experiencing some mood disturbance or some emotional disturbances still. Would you say that that's accurate?
Yes.
Awesome. Not necessarily awesome, but that's an accurate description from the test results, which is good. Would you say that you're experiencing a low amount of anxiety like was indicated, or do you think like it might be a little bit more intense?
No, I feel it's low.
Low. Okay, awesome. We're glad to hear that. I think that your results do indicate that there, like we said, there is a little, maybe potentially something going on, but I think it is something that we could maybe do like a mindset shift or talk
Mm-hmm.
about what your goals are, and what could be potentially helpful for helping you kind of come back down to 100% good, because you're probably at about 75 to 80% now, I would say, based on your score results, and we would like for
Mm-hmm.
you to be at 100%. What do you say?
Mm-hmm. Yeah, I agree with that. That makes sense.
Okay, awesome. And